Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Our topic today in Neighborhood Health Watch is obesity and weight loss surgery. Each of us probably knows someone who can eat whatever they want, whenever they want, and not gain a pound. At the other extreme are people who seem to gain weight no matter how little they eat. Why is that? We do know that obesity is linked to increased risk of heart disease, type 2 diabetes, high blood pressure, certain cancers, and other chronic conditions. What are the causes of obesity? What allows one person to remain thin without much effort, but has another person struggling to keep the weight off? Dr. Matthew Brigham with Parham Doctors Hospital is here to get some answers to those questions. Let's start off with, why is that? Why do some people struggle with weight and others don't?
Probably the big differences in weight are genetic, right? So there's a lot of genes. There have been over 100 genes identified in terms of relating to our weight. But then it's a combination of environment and our occupations and our medications and our sleep habits and this sort of perfect storm that comes together inside of us to make us either gain or lose weight. And for most of us, that's weight gain, right?
How much of a problem is obesity in our country?
Obesity is a big problem, right? So a third of Americans are obese, 2/3 of Americans are at least overweight. And so we have a lot of work to do there.
In reading over your notes, you talked about something called the set point. Explain how that works and how it keeps people at a certain people at a certain body weight, regardless.
Yeah, right. So we have this sort of thermostat in our brain, and that thermostat is keeping our weight where it is located now. So even if we gain weight, our body wants to keep it there. If we eat a little too much, our body will burn a little more energy. If we don't eat enough, it'll make us want to eat. But when we go on a diet, our body really acts against us to make us hungry and eat more food.
And talk about some of the wonderful things that you seem to be excited about in terms of the Center of Distinction Plus, the center where you work.
Right, so our center at Parham Doctors Hospital is now a Center of Distinction Plus with Blue Cross. And that means that we're providing wide spectrum of care from medications to devices to operations for all the different needs in weight loss surgery. And we're doing it with extremely high quality. The center is important for those people in Virginia with Blue Cross, which is the majority of Virginians, and in that they can access our care through their insurance.
It's a difficult decision to make when a person has to choose a doctor. What are some of the things someone looking for weight loss surgery should look for in a doctor?
Yeah,
in addition to training, of course.
Well, of course, right? So weight loss surgery is really important because it's two things, right? It's expertise and technical skill, right? We're going to do operations and we want to do them well. You can look at results for that. But your weight loss doctor is your partner, right? This is a year-long journey, and somebody who's got to support you. They have to know your goals, and they have to work with you to lose that weight. And so I encourage people to see their doctor. You want to like your doctor, and shop around if you need to.
Right, and trust the doctor as well.
Absolutely.
Dr. Brigham, thank you so much for joining us here on First Aid.